A closer look now at the epicenter of this Ebola emergency in Africa, still out of control. More than 9,000 cases, at least 4,500 people have died. One bright spot, the outbreak in Senegal just declared over. But the World Health Organization warns we could see up to 10,000 new cases a week by December. Liberia hit hardest right now, and New York Times reporter Sheri Fink is there at an Ebola treatment center. She joins us by Skype. And Sheri, thank you for joining us. Give a sense of where things stand right now.
So this treatment center is in Bong County, which is a more rural county, and they saw about 40 patients this week, admitted 40. About 12 of them were positive for Ebola. They had 7 patients die, but 4 patients who had been here for a couple of weeks were released. They were cured, and that really cheered everybody up. Of course, this is a small piece of this larger puzzle, and what we saw this week here was visits from the commander of the military forces, the U.S. military. We saw the American ambassador to Liberia coming, as well as a number of charities that are going to be part of this U.S. surge, creating these types of treatment centers in multiple places around the country. They're coming here to learn at this International Medical Corps treatment unit here. One of the big issues is trying to find the people who need the help and convince them to come to the treatment centers for isolation and for treatment.
So is the feeling on the ground there and across Liberia that you're starting to get ahead of this, or not there yet?
It's really unclear. I really don't think, I asked the ambassador that, and she said it's just too early to say that yet. What we are seeing is more resources, more of these treatment units opening up, but there's not yet a sense that everybody is being reached. And a number of the patients who came here this week were already very sick before they arrived. And so that indicates that there's a lot of Ebola kind of out there that just, the aid workers aren't reaching, the contact tracers aren't reaching yet.
Okay, Sheri Fink, thanks very much for your time this morning. Good luck.
Thanks.
Let's get more on this now from Dr. Helene Gayle, President and CEO of the humanitarian group CARE USA, which is on the ground in West Africa, and Richard Preston, the journalist who wrote the 1994 book on Ebola, The Hot Zone. His new piece on the West Africa Ebola outbreak is out today in the New Yorker. Welcome to you both. And Dr. Gayle, let me begin with you. As we just heard from Liberia, from Ms. Fink, too early to say whether they're getting it under control. I know CARE is on the ground there as well. But I wonder if you might respond to something from the UN official in charge of this, Anthony Banbury, who says that within 60 days, according to the WHO, we must ensure that 70% of infected people are in a care facility and 70% of burials are done without causing further infection. We either stop Ebola now or we face an entirely unprecedented situation for which we do not have a plan. What is it going to take to hit those markers?
Well, it's going to take the right kind of resources and the right kinds of plans. And as the previous speaker said, we're starting to see signs that the scale-up efforts are actually making a difference. And so I think the good news is that we know that the right kind of resources and the right kind of inputs and the right level of effort in really does start to produce results. And that's what we really need to focus on, that if we can put the kind of efforts, the kind of resources, and scale up the treatment as well as the prevention efforts for this epidemic, then we can have an impact. And we're starting to see that, but nowhere yet are we doing enough to really stem the tide. And it does take, first of all, making sure that the treatment centers are in place so that people who are seriously ill can get the treatment that they need and save as many lives as possible. But it does mean getting to those communities where there are people who are infected already and who are continuing the chain of transmission, to make sure that they're getting into isolation and treatment centers and starting to break that chain of transmission.
And Richard Preston, it also means staying ahead of the virus itself. And you say you've talked to a lot of scientists who are tracking this virus, and you say the question of how it's mutating is of significance for every single person on Earth. So what do we know about how this virus is mutating? And, there's so much concern out there that it could transform itself into an airborne virus. Is that a real concern?
Well, the whole notion of airborne needs to be defined. I think there's been a lot of loose talk among folks about what do we mean when we say airborne. And there are really 2 different ways that a virus can go airborne. And one is what they call droplet infection. That's if you cough or sneeze or if you throw tiny little liquid droplets into the air, they can only go about 3 feet, and they fall to the ground. That's considered direct contact. But the other way that a virus could mutate and change, which Ebola is not doing and isn't going to do anytime soon, is for the virus to be able to be dried out in small particles, like dust motes, that can then float long distances through the air and then infect somebody right through the lung. We've never seen a virus do this as it evolves in nature. It's very unlikely that Ebola will do it here.
And how about the efforts to come up with a vaccine that could combat it as well? Are they staying ahead of the mutation?
Well, you know, it's very interesting. There are scientists at Harvard and MIT who are reading the code of Ebola. Ebola is a fast mutator, and it changes constantly. It even changes a little bit inside the body of each person who is infected with it. So the question is, we need to keep our eyes on the enemy. We need to see exactly how it's changing. Because as it changes, all of the drugs and vaccines and tests for it are all keyed in to the genetic code of this virus.
Finally, Dr. Gayle, what's the most important thing we should be doing right now that we're not doing?
I think the most important thing that needs to be done, particularly in the countries where the infection is having its greatest impact, is making sure that we're mobilizing communities, getting prevention information out there, and making sure that people who are infected or at risk because of ill family members or close contacts get the information they need and are getting into treatment and isolation so that we can break the chain of transmission. That will take resources, it will take scaling up, and it will take everybody, the private sector, the not-for-profit sector, governments, all working together in a coordinated fashion to make sure that we're doing what we know needs to be done in an epidemic outbreak to stop that chain of transmission.
Dr. Gayle, Richard Preston, thanks very much for your time this morning. Our closer look now at the epicenter of this Ebola emergency in Africa, still out of control. More than 9,000 cases, at least 4,500 people have died. One bright spot, the outbreak in Senegal, just declared over. But the World Health Organization warns we could see up to 10,000 new cases a week by December. Liberia hit hardest right now, and New York Times reporter Sheri Fink is there at an Ebola treatment center. She joins us by Skype. And Sheri, thank you for joining us. Give a sense of where things stand right now.
So this treatment center is in Bong County, which is a more rural county, and they saw about 40 patients this week, admitted 40. About 12 of them were positive for Ebola. They had 7 patients die, but 4 patients who had been here for a couple of weeks were released. They were cured, and that really cheered everybody up. Of course, this is a small piece of this larger puzzle, and what we saw this week here was visits from the commander of the military forces, the U.S. military. We saw the American